Today, we're going to talk about how you can report your at-home COVID test results, an update on changes with contact tracing, as well as an update on how COVID data is reported. It is January 20th. We are with the Unified Government Public Health Department. My name is Janelle Friesen. I'm the Public Information Officer.
And I'm Hannah Connor. I'm an epidemiologist with the Health Department.
So we know a lot of people are using at-home COVID tests, and we've gotten questions about whether people are supposed to report that and what that looks like. Can you speak to what that looks like now in Wyandotte County?
Absolutely. So we just launched an online reporting form, which we will link to in the video description. All you have to do is when you take an at-home test, you answer a few questions, such as which zip code you live in, what type of test you took, and what your results were. If you do take an at-home test, we ask that you take a couple of minutes to report this online. If you test positive, don't forget to stay home so you don't spread the virus, and reach out to anyone you've been in close contact with so that they know to quarantine or to get tested.
And this is only for those rapid tests that people do themselves at home. This is not if you go somewhere to get a test.
Correct. Those will be reported separately by the facility that tested you.
Right, great. So another thing people are hearing about a lot is changes regarding contact tracing in Kansas. What does this mean for Wyandotte County?
So essentially, we've had a very high volume of positive people in Wyandotte County in the past month. And because of that high volume, we simply do not have the capacity to do contact tracing. And what contact tracing means specifically is calling the contacts of somebody who has tested positive for COVID and telling them how to quarantine. Instead, we are instructing the person who tested positive how to contact their close contacts themselves. This is in alignment with KDHE, who made this announcement first and instructed the LHDs or local health departments to do the same if they felt that it was appropriate for their capacity. In this case, if you did test positive, we're asking for your help with reaching out to folks that you've been in contact with while you've been infectious. That way you can let them know that they've been exposed to COVID and they can either quarantine or test or mask as required.
You referred to LHDs. What does LHD stand for people who might not have heard it?
Local health department.
Okay. And so just to make sure that I'm clear on this. So if someone tests positive, they're still going to, our folks at the health department will still call people who test positive, just not the people they were in contact with, right?
Yes, that is correct.
Okay. So I want to wrap us up by talking about some update with COVID numbers and data. There was a recent change to how our percent positivity is reported. Can you explain what happened with that change?
Yes, we recently changed how we calculate percent positivity. Percent positivity is the percent of people who test positive among the different tests done in the county. Previously, we attempted to filter out people who were retesting, but the current method looks at unique positive cases divided by all the unique positive cases in all negative tests. We made this change to align with KDHE's method, so it is easier to compare across Kansas communities. What's important to note here is that while the number has changed for the percent positivity, the trend has not. It did trend upwards during January quite drastically as Omicron spread through the county. None of our other reporting methods have changed, and they are still in alignment with the methods that KDHE uses.
All right. Thank you for talking about that. So if people do look at our COVID data, all the other numbers they'll see are the same, and the percent positivity, if you see the numbers look different now, it doesn't mean that the situation has changed. We're just calculating it differently. And again, we're still seeing really high COVID numbers overall this month so far. Okay, thank you so much for going over these updates. We're again going to put some resources in the description. We'll see you next time.
Thank you.